Okay, everyone, thank you very much for attending. My name's Isaac Allen. I'm a Senior Project Officer and Stakeholder Liaison at the Gold Coast Primary Health Network. And this evening, I'd like to give you a little bit of information about the Workforce Planning and Prioritisation Program, or the WPP for short. It's a bit of a mouthful, so I'm going to shorten that as we go on. So by way of introduction, I've said who I am, and if anyone would like to email me to get more details about the WPP, feel free. My details are there. Now, before we go on much further, I'd like to acknowledge and pay respect to the land and the traditional practices of families of the Yugambeh language region of Southeast Queensland, their elders past, present, and emerging. And just a quick little bit of housekeeping. Could you please, everyone, keep your cameras off and your microphones muted unless you're invited to participate. So questions via the chat to everyone function will be utilised, and I'll get to them at the end of the presentation. The session is going to be recorded, and it will be retained for the presentation, that part that is. But in the discussion afterwards, what we're going to do is we're going to record that. I'm going to minute it and note it appropriately, and then I'm going to delete that section of it. So without further ado, let's get into it. So for this presentation, I'd like to give you a bit of context of the WPP, why we're doing it, and the intended outcomes, a bit of an overview of it, some common discussion points to really get people thinking about the next steps, a very short survey. And actually, I've had a practice manager today beat that record. She did it in 3 minutes. Not that this is a competition, please. If everyone, take your time in completing it, it'd be really, really helpful for us, because we want to make sure we have an accurate picture of things on the Gold Coast. And then I'll open the floor up to discussion and questions. Okay, so responsibility for the Commonwealth funded, sorry, I've just hit the wrong button, do apologise. Responsibility for the Commonwealth-funded AGPT training program was transferred to the GP colleges as of February this year. Now, the Department of Health conducted an open and competitive grant opportunity for the GP WPP, that's its full name, as part of their Health, Workforce and Rural Access program. Brisbane North as our lead consortium, but we all tendered and successfully tendered to be the consortium across Queensland, and everyone throughout Queensland is going to be taking part in this. Indeed, everyone throughout Australia, all PHNs are. The General Practice Workforce Planning and Prioritisation program has been created to support the transition to the college-led GP training program through the provision of robust, independent and evidence-based information on planning and prioritisation of GP registrar placements to meet workforce needs. And this is why we need your expertise and experience to really get an accurate picture of what this looks like on the Gold Coast, so we can then present that to the Department of Health and the colleges. So why do we need to do this? We know the importance of workforce planning in the healthcare sector and the need for a well-trained and adequately staffed workforce. And this really speaks to, or tries to meet, the growing demands of an aging population. We need to get our voices heard on this piece of work. As I mentioned previously, every PHN in the country is doing it. We need to ensure that any statistics we do use also have a good level of qualitative data underneath it. And what I mean by that is, if you look at just the raw statistics for the Gold Coast PHN, and you compare them perhaps to our cousins out west and northwest, looking at GP per capita is perhaps not the best metric to be able to measure things. And last but not least, we can really shape the discussion to better represent our interests and the opportunities that we offer across the GCPHN, namely the established links with our 2 universities and other things we really bring to the table in terms of GP training. We can give the DOHAC and colleges better and more useful information than that single metric that I mentioned previously. And currently the Queensland approach will be to categorise the regions based on various metrics rather than just a single metric there. So really, what does the future hold for the Gold Coast region? Now, if I could answer that, I'd be a very rich man. But I think we can all acknowledge that the Gold Coast has seen considerable population growth over the last 10 years. Now, this slide just gives you a little snapshot of GP attendances across that timescale. And I think moving forward, we're going to continue to see, certainly in the north of the Gold Coast, a large increase in the demand for services. And we need to try and ensure that we are well positioned and we have a workforce that is well staffed to be able to meet that need. And this is where we need your experience to help really steer us in the right direction and give us crucial data to write our reports for the Department of Health and the colleges, because we want to try and ensure that the primary care on the Gold Coast is educated and well staffed and has a strong outlook for the future. So I just want to give you a very quick snapshot of the key elements and the key deliverables of the WPP. You can see there in the first or second row down, the workforce needs and training capacity reports. Now they're both from this current year, and then the training pathways report will be from next year. So they'll bring together the quantitative and qualitative information to help the GP registrar placement decisions that will be taken by the Department of Health and the colleges. So the objectives include analysis for community needs on GP services. So this in help forms the targets that the department are going to set. Analysis on training capacity. Now this helps match the registrars with where the need is and where we could potentially build additional training capacity. And that really speaks to one of those categories that I mentioned earlier that the Queensland Consortium is going to report on. And the third objective is to document the training pathways across the region. Now this provides transparency to the colleges about different rotations where you can do all of your training within a region if a registrar so chooses to do so. Now, this visual shows the elements or the essential elements of this work. It's important to note what is out of scope for this project. And I really want to emphasize this because I don't want to make empty promises, because I really want to make sure we deliver on what we say we're going to. So first of all, setting the actual distribution targets for delivery of the GP registrars, that rests with the Department of Health. Our work will inform this, but it is not about mandating where placements will occur. Number two is the responsibility for the AGPT placement decisions and management of individual GP registrars. That rests with the GP colleges themselves, as does the pastoral support of GP registrars. The right-hand side of the slide there captures the 7 individual PHN localized roles when the practice-facing and data roles. So you've got myself as the PSSL officer there. You've got one of my colleagues as a data analyst and some program officers. And then we've also got a GP advisor in Tamara Warby, who is on here on our staff to make sure that we can constantly relate what we're doing and how we're providing the reports back to something that's actually usable for GP practices. So before we get into the actual survey, I would like you to have a bit of a think about some of the discussion points that I've picked up on my engagement sessions across the Gold Coast so far. And the reason being is after this, as I mentioned, I'll try and get you to complete that survey, and then we can have the discussion after that. And I found that by presenting some common discussion points first, it really gets people thinking about the answers that they're going to give in the survey, and potentially where the survey doesn't go far enough. And that's where our discussion really comes into it, where we can try and establish some qualitative data to be able to put underneath those statistics that we're going to present. So first of all, patient access. Numerous practices have reported a steep increase in the number of patients they're seeing per day, and some are turning away, somewhere between 5 and 30 patients a day. So because of that, are we thinking that it's purely a function of numbers, or are we thinking that it's complexity as well? And is that associated with an aging population? Something to think about. And this is really necessitating an alternative workforce model that utilizes registrars more so than they currently are. And most practices want the registrars, but they can't seem to get them. And that is another common theme across the Gold Coast. The strengthening Medicare recommendations, they really try to set out to delay admission through RACFs, through better aging at home and in the community. Unfortunately, or fortunately, however you look at it, that's going to increase the stress on general practices through that. So how does that really come into things, and can we capture that in these reports? And what do you think, as I mentioned before, is behind that increase in services that we're seeing? Is there other factors such as mixed billing, practices moving from bulk billing to mixed billing? It's I've heard both sides of the coin when I've been out chatting to practice managers, so I'm really keen to hear your take on that. Okay, if everyone could grab their smartphones, please, and have a little scan of this. As I mentioned, it's quite a short survey. I would say the average time is around about 6 minutes, but feel free to put as much or as little detail in there as possible as you feel fit.